Clavicle fracture. The clavicle connecting the upper extremity to the axial skeleton. In this presentation, we'll explore fracture types, symptoms, and modern approaches to diagnosis and treatment. Let's dive into this brief but insightful journey into clavicle fractures. Thank you for joining us. Clavicle is S-shaped. The clavicle speaks, "I am the first bone to ossify in the body. I ossify from two primary centers. I am the only long bone in the body lying horizontal. I am the only long bone ossifying from a membrane. I am the most common bone to be fractured in children. I end up maluniting after the fracture." Functions of clavicle. It increases the arm strength mechanism. It protects the neurovascular bundle consisting of subclavian vessels and brachial plexus. It gives attachments to important muscles around the shoulder. Mechanism of injury. Direct. Due to fall on the point of the shoulder. This is the most common mode of injury, accounting for 91% of the cases. Direct trauma. Direct trauma over the clavicle due to RTA, direct injury, etc. accounts for 8% of the cases. Indirect fall on the outstretched hands accounts for 1% of the cases. Sites of fracture. 85% of the fracture clavicle occurs at the junction of middle and outer third. Medial end of the clavicle, 5%. Lateral end fracture is uncommon, about 10%, distal 1/3. Classification of fracture clavicle, Allman's. Group 1 is fractures involving middle 1/3 of the shaft. Group 2 is fractures involving the lateral third distal to the attachment of the coracoclavicular ligament. This is further subdivided into two subgroups, proposed by knee. Type A, coracoclavicular ligament intact. Type B, coracoclavicular ligament ruptured. Type C, intraarticular extension into acromioclavicular joint. Group 3 are medial third fractures. Clinical features. The patient presents with pain, swelling, deformity, and inability to raise the shoulder. Rarely, the patient may present with pseudoparalysis of the affected arm. Radiographs. The following views are recommended. Routine AP view of the clavicle. Lordotic view if the fracture is doubtful. Distal clavicle requires special radiography technique. Principles of treatment. Before proceeding to the treatment proper, one needs to understand the two distracting forces acting on the fracture fragments in clavicle, making the treatment difficult. The sternocleidomastoid muscle pulls up the medial end of the clavicle, and the pectoralis major muscle and gravity acting through the arm pull down the lateral end. Conservative methods. This is the treatment of choice in fracture clavicle and consists of the following methods. Cuff and collar sling for undisplaced fractures. Strapping of the fracture site after reduction of the fracture by elevating the arm and bracing the shoulder upwards and backwards gives good results in both children and adults. Billington yoke method uses a plaster of Paris over a well-padded figure of 8 dressing. Figure of 8 is popularly used, and it acts by retracting the shoulder girdle, minimizes the overlap and allows more anatomical healing. It does not immobilize the fracture, but acts by serving as a reminder to the patient to hold the shoulder up and back, neutralizing the forces mentioned above. If they allow the shoulder to slump forward, then the support cuts into the anterior axilla and reminds them to hold the shoulders back. Treatment plan. Newborn to perambulatory children, treated symptomatically, bind arm to the chest. Ambulatory stage, 2 to 12 year figure of 8 bandages, tightened after 3 days and later 1 week. 12 years to maturity, commercially available figure of 8 harness. Surgery is rarely indicated and consists of open reduction and rigid internal fixation. Methods of internal fixation. Intramedullary fixation with K-wires. Rigid plate and screw fixation. Indications. Open fractures. Fracture near acromioclavicular joint. More specific indications for open reduction and internal fixation of fracture clavicle. Shortening or distraction of fragments for more than 2 centimeters. More than 100% displacement or fragmentation. Bilateral fractures. Thanks for watching. Enjoyed the video? Give it a thumbs up and subscribe for more content. Turn on notifications, never miss a video, hit the bell. Share with friends. Comment, we love hearing from you, share your thoughts.